insights, inspiration, and practical tools to help transform your health, reduce chronic diseases, and improve your well-being. Learn from leading health experts, researchers, and practitioners as they share cutting-edge information and advice that will help you make informed decisions. Join Mary, the Slim Diva, every weekday from Mondays to Thursdays at 11 a.m. on Echo FM 100.7 Owerri. Health Revolution, your daily tonic for healthy living.
Okay, 4 minutes past 11 this lovely Wednesday morning. And it's midweek already. How are you today? I trust you're doing great. Some people have not allowed me to. In fact, I never hear word since yesterday. Arsenal. Up Blues.
Are you kidding
Up
me?
Chelsea.
Are you kidding me?
Chelsea.
Why
something.
should no? I'm
Are
not.
you an Arsenal
saying,
fan?
Yes, I am.
No. We cease to talk to each other
unapologetically
from today.
Wholesome.
Just know that I will no longer co-host
only
this program with Dawn. No.
Arsenal.
No.
The only tomato queen.
Blues for life. We're
In
going
Arsenal.
to. You
Can
see
you
this
imagine?
argument. We'll continue later. No. Okay. It's good to know you're right there listening to us from wherever you are. You're tuned to Echo FM 100.7 Owerri. I remain your host, Mary Omeniwo. They call me the Slim Diva. You're most adorable.
And I am Judge Dawn Ekoma.
Thank you, Barry Cosmos, as usual, for handing over to us this morning. And today's edition of Health Revolution is going to be sponsored. It is a sponsored session. The whole 1 hour has been paid for by Precious Healthy Life Foundation and partners. Wow. And for them to have sponsored this program, then you know that whatever it is they want to sensitize the public about is very, very important. And I'd like to thank our guests for making it down to the studio this morning. Dr. Oparocha Damian is here, and he is the president, Precious Healthy Life Foundation, and also the MD, Precious Stone Specialist Hospital. Good morning to you, Dr. Damian.
Good morning very much.
It's good to have you in our studio.
Thank you.
You're welcome. And I hear that Dr. Mark Okwelebe, MD, Mark of Glory Specialist Hospital, is still on his way. So the moment he gets here, he will join the conversation. Dr. Van Ohaya, the CEO, Trustee Drugs Incorporated, and founder Ohaya Global, will join us via the phone. I understand is somewhere in Lagos. So let's see how this turns out. To some extent, all the questions will be thrown at Dr. Damian for now until we are joined by Dr. Mark and Dr. Van. Okay, so I know you're wondering what exactly is the topic, but before then, I'll have to give credit to Ambassador Uzoma, who's also here seated in the studio. He might not say much, but he's just here observing. You're welcome, Ambassador Uzoma.
Thank you. Good morning.
Good morning to you. Okay, so to the topic for today, our focus is going to be on the 5th annual Healthy Heart Seminar that will be coming up very soon. And the theme for this year is Healthy Diet, an essential secret for a healthy heart. So I'll start off with Dr. Damian. Help us. This is the 5th edition of the Healthy Heart Seminar. Go ahead and tell us about it. And would also like to find out what inspired this year's edition. Go ahead, please.
Thank you very much. As you can see, this is the 5th edition of Healthy Heart Seminar. It's actually an annual event with which we actually commemorate the resurrection, my resurrection from death. Because I resurrected by God from from what we call heart attack on the 5th of February 2022.
Oh, man.
And having survived that by the finger of God and prompt medical attention, I decided to carry out campaign against heart diseases. And this is being made possible by Precious Healthy Life Foundation and our partners. I'm going to be mentioning our partners.
Go ahead.
Yes, the major partner to this foundation, to what we are doing, so to speak. We have 3 of them, but let me talk about the one that actually led to or encouraged me to begin this campaign. Ordinarily, I wouldn't have, but because part of the treatment I received was in his hospital. On the 5th of February, as I said, 2022, having slumped in my house,
Oh, my God.
and quickly taken to Federal Medical Center Owerri, now Federal Teaching Hospital Owerri. I was in the ICU, and then doctors, nurses, everybody rallied around because I worked there anyway. So everybody, my wife on the way was contacting people I didn't know because I wasn't conscious enough to know what was happening. So reaching there, the action started. Within less than 1 hour, I was on my way to Port Harcourt, where ambulance was gotten, 2 doctors, one anesthetist, one cardiologist, and then an intensivist nurse. So they ferried me to Port Harcourt, and when I reached Port Harcourt, the hospital I was taken to was Save a Life Missions Hospital.
Yes.
And before we reached there, they have contacted the team, and they were waiting for my arrival. As soon as I came, I was taken to what we call the cath lab. Cath lab is where the heart intervention is being done. Then what we call cardiac angiography, coronary artery angiography was done. That is, let me put it in layman's language, scan of the heart vessels that carry blood to the heart. And it was done, and they found out where the block of the artery happened, because cardiac attack, heart attack occurs as a result of blockage of one blood vessel in the heart. And so, having found it out, the procedure was carried out, and I became normal again.
Wow.
And that's why I am alive today.
Oh, my.
Now, having gone through that in that hospital, the director, whom I didn't prior to that time know personally, because 1, we didn't go to the same university, 2, is a very younger doctor than me, got across to me that it is good for us to talk about this to the people so that we can tell them how to prevent heart attack, prevent cardiac arrest, and then people live healthier than they ought to. So that's how we started the Healthy Heart Seminar. And the one we are having this year is a 5th edition. We have had 4 editions with different topics.
Okay.
The first one was prevention of heart attack. The second one is how to preserve your heart to live healthy. And then the third one, we dealt on stroke. The 4th one, we dealt on stress, how it affects the heart and brain. This time we are talking about healthy diet, an essential secret for healthy heart.
Wow.
So that's why we are here today, to enlighten the public on the necessity to know how to eat food and live healthy, and the type of food to be eaten, and how to eat, as it were, and when to eat. So that's why we are here.
Wow, this is interesting. I actually do not know what to say, but I also thank God on your behalf. I mean, to be alive, to have survived that kind of cardiovascular issue, and here you are talking with us today, healthy and strong. That's a lot more testimony to share. So let me say congratulations
Thank you
for
so
being alive, and also for a job well done trying to go ahead to sensitize people to live a healthy life. Okay, so now the theme, you have said it already: healthy diet, an essential secret for a healthy heart. Now I want us to talk a little bit more on the relationship between a healthy diet and a healthy heart. Why is this year's theme important?
Yes, it is very important. If you look at the topic or the theme, you are looking at healthy diet. You can eat and not eat healthy. And when you don't eat healthy, it is inimical to the body. And central to this attack of unhealthy diet is the heart. Why I say so is that the heart is the engine of the body. Anytime the heart fails, the body is on either the verge of death or or has died. So, because we are looking at issues of the heart, my foundation through this Healthy Heart Seminar looks at the well-being of the heart, which is the engine house of the body and of the life of people. So we're now looking at things that can, affect the heart positively if done right, and the things that can affect the heart negatively if done wrong. So diet becomes central, because if you look at most of the diseases that people suffer from, stem from dietary, or either wrong dietary application or, inadequate application, as it were.
Okay.
So we are bringing to bear the knowledge of this diet to the health of the heart, so that the heart will remain healthy for the person to remain healthy. So that's the relationship. So if you, it's like you remove fuel from a car. You understand? If you remove fuel from the car, there's no way the car can move. And so, or the engine knocks, let me put it that way. If engine knocks, what will move? The car will not move. So in the body, if the engine of the body fails or knocks, as it were, then there'll be problem. So that's why we are looking at it, so that we will have, healthy heart and healthy life. Thank you.
Okay.
Okay, sir, thanks so much for, your story so far. But my question goes this way. We have so many ways we eat that truncates our eating habits. Do you mind explaining to us what are those eating habits that can actually increase the risk of our heart disease?
Yeah.
Or increase the heart disease?
Yes. I will just pinch or take it. I'm not going to go deep, because that's the essence of the seminar. So the people, I'm not going to be speaking there.
Okay.
We have very seasoned guest speaker, or the keynote speaker, who is going to speak on all this. And we also have people who are going to speak as well. We're going to be having a panel of discussants who will be going to x-ray in these areas, different areas of diet. How you're going to eat, how you're not going to be eating, when are you going to eat, what are you going to eat, all those things are important. As a matter of fact, this is the first of the series of the healthy diet, an essential secret to a healthy heart. So it is the first of the series, because we've seen that diet, number one, is very important. And number two, to the body. Number two, if well taken, if taken the way it should be taken, people tend to live longer. But number three, if it's taken wrongly, people shorten their lives or attract to themselves diseases that they ought to have avoided. So that is the essence of this. So because this first in the series is going to be a bit introductory. Then when next year, we are going to be doing some specific areas of life, like how does diet, wrong diet cause cancer, and all those kind of things. So, and we're going to be looking at them so that, people will know how to handle their food and all that. So
Thank
it's
you.
going to be all encompassing.
All encompassing.
yes.
That is good to know. So, from what you have just said, majority of the sensitization will be done
Yeah.
during the seminar.
Yes.
Yeah.
So, go ahead. People are listening, okay? It's good it's coming from you because you survived that attack. Okay, and I know that people would listen to you more, you know. So go ahead. Who are the target participants for this particular seminar you're organizing?
Well, it is a seminar for all. If you have attended our previous seminars, you will see high-class professionals. You will see governmental officials. You will see the masses. You understand? Everybody comes to listen, and they are coming to learn. And when they learn, they go on to apply. So, for instance, the first seminar we had, we had a commissioner of health then, who is Dr. Success Prosper Ohaya. He was there live. Then the then CMD of Federal Teaching Hospital now was there as the chairman. That's Professor Achibu Kingsley.
Okay.
He was there. And then CMDs, MDs of hospitals, Dr. Obi Iwagu from UK, he came down and attended. And from there, we opened up a chapter, of relationship with a team from India. Wow. Because from what he saw, he began to improve his laboratory, or his diagnostic center in the area of cath lab. Then a lot of doctors, nurses, other professionals, engineers, yes, they all participated. The masses, they came to listen and they came to learn, and so it's for everybody. It's not that it's a professional. We are
Gathering.
we are doing a seminar for professionals,
Okay.
where you have to be talking technically on professional things. We bring the message down to the grassroots. Okay. Why we do that is because when people consult, when people consult doctors in the office or prescribers, there is little or no time to sit down to tell people the nitty-gritty of what they ought to know because of the crowd that we wait. We consult in a government hospital. The crowd will not even allow you to drink water, not to talk of settle down to talk to somebody the way the person will understand and prevent diseases.
Yes.
So we tend to be writing prescriptions, next, you write next, right, next. That ought not so to be. We should have time. But however, since there is not much time in the hospital setting, we now create this time so that people come, you ask questions, you relax. You relax. I'm going to tell you a little of what we're going to be doing, maybe as your questions come.
Okay.
But the issue is that they relax in a very relaxed environment. And they ask their questions. You're at home with those people you think that are very highly placed, that you cannot ask certain questions because of little time, and then you are scared. Maybe he will shout at you because of the pressure of work or because of, somebody is rushing out to do some other things and all that. So we're going to create a relaxed environment, and they sit down and ask questions and learn and go.
Indeed, indeed, we need more time. You see, this patient-doctor relationship, we want it more. So I want to suggest to you, sir, that instead of doing this, just annually, you can as well do it twice every year or 3 times every year, as the case may be.
If I may put in, maybe I just, jumping the gun, but let me speak it here.
Okay.
So Precious Daily Life Foundation we are domiciled in Owerri, but it's a global body.
Okay.
You understand? Even though we've just started new, but it's a global body. We have, as I'm talking to you, the person we are expecting, his call is from US.
Okay.
So he just came in this week, and he has joined us to make this work. So having been there, and I also have one of our partners, Mr. Nosike Isdor, is in the US.
Okay.
So he is the one who is even who brought to bear some of the instruments we use to resuscitate patients. So it's not a local something, but to make it twice annually it is possible. What we are doing now is we have zoned the state into 3. Okay. We have zoned the state. After the seminar, we're going to decentralize it to the different 3. I mean, the 3 different zones, so that we also have zonal seminars. You understand? We are going to be having zonal seminars. It is very important.
Very, very.
So that we can reach out to more people, the grassroots, reach whether, poor and rich, whatever. We reach out to them. The campaign is very important. And again, we are training people on CPR. We have the mandate from government to train people on CPR.
Okay.
We have approval for that.
Yeah, I was going to come to CPR. However, apart from the lectures that people will just come, sit, listen to what you have to say, will there be free medical services attached?
All right. Can I talk on CPR first?
Okay, go ahead.
Go
ahead, please. Go ahead.
CPR, what is CPR is what we call cardiopulmonary resuscitation.
Okay.
Cardiopulmonary resuscitation in layman's language is called chest compression. Somebody has stopped on account of cardiac arrest. It's a common thing now, stop and die. That's how they call it now.
Yes.
And they make joke out of it, but it's not supposed to be. It's not something that we should make light of, because when somebody slumps and you don't do anything, there is 100% death.
Very true.
But if you begin to do something, you can resuscitate the person and bring the person to life. And that's what we are doing. And we found out that most of our time is spent in the workplace. So I'm sure that some of you know what I'm.
Of course, we do.
You leave your house very early in the morning. You are going back late at night. You just have a few hours to stay in your house. So most of our time is spent in the workplace. So we have really programmed our training for resuscitation to different levels of life existence. We have done a seminar for CEOs and managers of establishments, organizations, and companies, even ministries in this state. There's that seminar held on the 18th of September 2024. The essence is to sensitize them, let them understand the essence of having a resuscitative team in their companies. And also, because that's where you can get people easily in the workplace. So we got them to a seminar at Rento Hotel, paid for by us. When you rent a hotel of that particular standard, it is not bread and butter.
Yes.
So we hosted them and they came. So because of that, we have started to train people at the workplace. In fact, Rento Hotel hired us to train all the staff of 100 and something people.
Wonderful.
Running for more than 1 month. We trained them.
Okay.
Wow. Yes.
And then are there, do you give out certificates after the training?
We do certificates for our training.
Okay.
But if you want a certificate that you can use to travel internationally. So we have a certificate from American Heart Association, which is an umbrella body regulating emergencies, heart emergencies all over the world. You understand? So we have our partner in US, is the one who is working on it and then giving us certificate for whoever that wants certificate for training. And you come for the training because you have to be put to a very rigorous period of training before you can earn the certificate.
Wow.
So that's what we're doing. So as per that's what we are doing. We are going to carry it to the schools. We are going to carry it to the grassroots local government areas.
Good.
So that's what we are doing for now. And in fact, that's the essence of zoning the state into 3.
Okay.
So that when we are doing these things zone by zone, before 5-6 years, we should be able to cover the whole state, in the knowledge of this.
Not just the whole state, the whole of Southeast and Nigeria at large. It's a big one, but I know that definitely you get there.
You see, you are always jumping the gun.
because I want to see this change. We come here almost every day on the health program to talk about, how people can stay healthy. But I feel that if this message goes far, it will help save a lot of lives. Talking about CPR, I'm even, to some extent, I don't want to go deep into CPR because I have seen cases where people slumped or people fainted and people were just staring at them. They didn't know what else to do. Several times we have talked about CPR on radio, right? But it's always better off if you're there to demonstrate it physically and do the practical aspect. And that's why that training is very, very important.
You're right.
Okay, so I can also see the trustee Med Mission software. I actually do not know what that is, and Dr. Venn was actually supposed to be the person to handle this session, but Ambassador Uzoma is highly capable, so I will throw that question to you. Let's start off with the importance of the Trustee Med Mission software, and yes, what exactly is it, and how is it related to what you're doing?
Okay, good morning. I'm sitting in for Dr. Venn Oyeha, who is the CEO, Trustee Drugs Incorporated, and equally the founder, Oyeha Global. Let me digress a little. He was supposed to be here, he's unavoidably absent, but he paid for a flight for 7, only for him to get to the airport, and the airline told him, your flight has been moved to 11.
No notice, nothing.
No notice,
Nigeria.
nothing. That is someone that is coming from the US.
Oh no.
Got to Lagos and now wants to get to our dear state to serve his own people.
Do you know how you explain that? Nigeria has happened to him. So say welcome.
So back to what Med Mission is up for this medical mission. Is a software that was developed decades ago, but with time, after having undergone series of medical missions and since flaws of what the software had, we had to improve it. And thank God, sir, I know you don't know, we are actually the first foundation, in fact, the first organization to actually use the improved version of the software in Nigeria.
Okay.
In Nigeria.
That's good to
So,
know.
what does this software do? The Med Mission, the Trustee Med Mission, what it does is that it helps healthcare provider, one, to collect patient data, two, to provide patient to doctor information, whereby the doctor doesn't need to stress to look for what if, let's say, a doctor wants to prescribe a drug, and he will start looking for asking the pharmacy, calling the pharmacy, how many drugs do you have in the counter, what do you have, this and that. No, the improved version now, you don't even need to type, you just need to click, and the AI voice command comes up.
Really?
You tell the software, please give me metformin, give me this for this patient, and it does the prescription automatically.
Wonderful.
Sends it to the next desk, which is the pharmacy, or if you need to send the patient to the lab, you just give a voice command and the app just does it.
Wonderful.
And sends it. So very seamless and very easy.
Okay.
So that's why we had to, he on his own heard about the work the foundation has been doing, and he said, okay, why can't I come to my people and do this for them? Let them have a test of this. And, he was supposed to be here and he's not. So this is what the people are going to see on ground.
Okay.
Not just getting to meet doctors, nurses in a serene environment where you have the liberty to talk to them and have all your time. People that normally you go to the hospital, traditional hospital, you'll be scared, you will not easily talk to them and have your time to tell them your issues. With this, you have all the time, and the nurse will not equally be under pressure to talk to you because he or she has something to work with, and that thing will make her work or his work
Very
easy to to take care of you. So that is the essence of the software.
I like
And
that.
it has is very. In fact, I hope we'll have an opportunity where our patients will come back to, talk or give a feedback of what they saw or what they experienced.
That depends
Because-
on you as well. That depends on you. If
So-
you give us that opportunity, we give you that opportunity as well.
But another beauty of this software is that it keeps patients' record, and it makes it very easy for us as a foundation, which is made up of doctors, to follow up with that patient. That's one thing. And not just that, you can use the software without the internet. You don't have any issue with the internet.
Oh, so you
can
just
use
download
it in any remote area. Yes, it has a dedicated server, a
Oh.
cloud database where it takes in the data,
Okay.
keeps in there. Whenever you have internet, it takes into the cloud.
Wonderful.
So you can use it in any remote. It's made for medical missions. Medical missions, we can, like, as our president was talking about zonal zones, how we will zone them. We are going to rural areas. We are going to villages where network is a challenge. Internet is a problem. But this is where the bridge is. This is where we cross it.
Okay.
That is why the software is now making it very easy for when you send personnel to that area, they use the system, they don't have any issue with internet. It's just that.
Go ahead.
And whenever you want to look at your patient history, you can just go on a click and you follow up with them. And whenever the patient equally needs that medical history, they can go to the system, pull it out, and share with whatever health establishment they want to refer them to.
That's
So
good.
that's the essence of the software.
Before
That's
Dawn,
super.
before Dawn would ask a question, I'm actually happy about this Trustee MedMission software. The part I like is for the fact that I would go to the hospital and you don't see nurses running around looking for my folder. That's what you're trying to say.
Paperless.
You just have to come, give your card number, they impute it, and they get
That's
your
it.
information.
That's it.
We've arrived, you know.
Yeah.
I mean, that's one part I hate. That's why I don't like going to the hospital, because you spend more time. They will go around looking for your folders, and most time they'll tell you, when there's an emergency and someone is dying,
Yeah.
and then you're expected to still go around to look
That's
for
it.
folders. But with this, I feel it's going to make a lot of things easier.
And should I shock you more?
Wow.
You don't even need to come with a card. It has facial recognition.
Oh, so you just
So
impute your
you
face.
just present yourself so far as you have been registered already into the system. You present yourself, it scans you, snaps you, and that's
Very
it. Every
good.
data is put up.
Very, very good. Okay, so before you go ahead, Don, Dr. Mark Okwelebe, sorry if I didn't pronounce your name correctly. I apologize. Dr. Mark is the MD Mark of Glory Specialist Hospital, and he has just arrived. It's good to have you join us this afternoon. Good afternoon to you, Dr. Mark.
Good afternoon.
And we've been expecting you. Thank you so much for joining us.
All right, thank you so much. Sorry, I had some emergencies.
I understand. Doctors always have emergencies. We understand. But
Yes,
thank you
you're
for
welcome.
coming, okay? So let's continue with the conversation. And we're talking about the Trustee MedMission software. Right after Dawn is done with this particular question, we'll open up the phone lines for the benefit of people who would want to call in to ask questions.
Okay. My question goes this way. You said something before the success rate, or before you actually started seeing the rate at which this app has actually gone far, or this particular program has actually gone far. Can you categorically tell us what are the success outlines recorded so far when it comes to MedMission software?
Okay.
Ambassador, yeah.
Yeah. Okay. Like I said, with time, in the time past, we've always had issues, which are the things that we had to improve in it. So, which are these functionalities that I mentioned.
Okay.
You have facial recognition, you have voice command, you have AI functionalities, you have the cloud storage, you have where it bridges using it without the internet visibility or availability in whatever area you find yourself.
Okay.
So until we had to expand to Gambia, where they have been dragging us, they have been dragging the company, bring it there, while the owner of the company is is a Nigerian.
Okay.
I don't know if I should continue the success without talking about the challenge because
No, they
it
go
has
hand
always
in
been
glove. Yes, they go
Yeah.
it
together.
has always been challenging.
Yeah.
You know, implementing this software in Nigeria. It
Yeah.
has the politics and the whole thing
Wow.
is something else.
For
The
something that will
ministry
benefit
that will
us.
benefit our people. Like the owner, which is Dr. Ven Oyaha, he's using his personal resources. Like this one right now, he had to use his personal resources to make sure, put it on ground, come book his flight from the US down here to come here and train. He'll be here. He's already in his way coming. He'll be on ground to train people, to train health personnel, to be on ground to make sure it's used properly.
Okay.
And at the end of the day, we are the one benefiting.
No support.
No
from
support
anywhere.
from anywhere.
That's bad.
The Ministry of
Seriously.
Health is not, but though before now we have the UNTH, UPTH, even FMC2 was using it, but you know with time, politics and all had to sieve it, so he had to just let go and improve on the software. And now, this improved version is being used for the very first time.
Okay.
All these functionalities I'm telling you now are being implemented for the very first time, which we are all going to witness it tomorrow
Okay.
at the venue.
That is very good to note.
Yeah.
Okay, so if you just tune in, you're listening to Health Revolution, and like I said earlier, the program is sponsored by the Precious Healthy Life Foundation and partners. The focus for today is on the 5th annual Healthy Heart Seminar, which will be taking place very soon. They will help us with the date, the venue, and the time, so you would be a part of that seminar. You have heard everything. It's all encompassing, from diet to healthy lifestyle to how you can avoid cardiovascular issues, and also the Trustee Med Mission software, which I'm hearing for the very first time, and I know that a lot of people will be happy about this new development. So you have questions for the team in the studio, or you have anything that is bothering you, right? That has to do with cardiovascular health and all of that. Now is the time for you to call.
Okay, and the phone line to call is 0911 20022, 0707 454 1014.
Try as much as you can to reach us. You can also go to Facebook, Echo FM 100.7 Owerri. We're live, and you see myself, you see Dawn, and you see the team of doctors and Ambassador Uzoma right here in the studio.
Hello.
Yeah. Good morning, the Don.
Oh, good morning.
You see, I'm back again.
Yes, we know.
Good morning, the Slim Diva.
Hello, Kachisin. How are you today?
Yeah, I'm fine. Good morning.
Good morning.
Yeah. Good morning, the team of doctors.
Good
Good
morning.
morning.
Good morning.
Yeah. I am Mr. Kachisin Ekuha. I am calling from my community, Avo, in the West Local Government. Yeah, please, the Slim Diva, first of all, I hope to look out for when Ojeziro will be featuring free medical check.
Very soon, that will also, be put into consideration,
Yes,
okay?
it really add color. I just thought of it now.
Yes, I know. Thank you. Please go ahead.
Okay, I want to ask 2 or 3 questions. Number one, is the program, is this a free, is it a free program where someone can have opportunity to run some checkup? Is it free of charge?
Okay.
Number one.
Okay.
2, will patients have the opportunity to talk to some of the doctors one-on-one to get counsel?
Okay.
And 3, anything about cardiovascular health and the checkup in the hospital is very costly. The equipment are very costly to run checks. So your platform or your company or whatever, is there the possibility of few people, maybe for example, if I just want to go and check anything that has cardiovascular related issue, ECG, or whatever. And how much they do charge in most of these laboratories and all that.
Okay.
So your outfit, your company or whatever, are you people giving us at a subsidized rate that will make people live where they go for check and come to you people? Do you understand my question?
I get you
Yeah,
100%. Thank you so much.
Okay.
Okay. Thank
Thank
you.
you.
Thank you
so
for that
much,
question. Before we go ahead to answer that, let's squeeze in more calls.
Hello, good morning.
Yeah, good morning, the Slim Diva.
Hello, Ama. You are welcome.
Thank you very much. Good morning, Dawn.
Good morning.
Yeah, some people say that cardiovascular issues are a result of sedentary lifestyle. But you can see some sportsmen suffering from it. I don't know what's the cause of that one.
Okay.
That's one. On your software, you are promoting.
Oh no, so sorry about that, Ama. Try as much as you can, change your position and call us back if you can. Okay, Dr. Mark, I don't know if it's okay to channel these questions to you because I know that Dr. Damian did justice to, the beginning of the conversation and all of that. So I'd like you to start by telling us if the seminar is free. Is there any amount attached to the seminar?
All right, thank you very much for giving me this opportunity. I'll just answer straight. The seminar is free.
Free.
It's
Okay.
completely free.
Okay. And we didn't ask for the venue. Let's quickly point out where it is going to take place and the time. And if there are phone numbers, people will need to call. Please, now is the time before we continue with the conversation.
So you can please permit me to do my president the honor.
Oh, okay.
Yes, you answered that.
Presido, Dr. Aparacha Damian, please go ahead.
All right, thanks so much. As he said, the program is completely free.
Okay.
It's free of charge. From the seminar to the medical missions. The seminar holding tomorrow, the 21st of May 2026. And that is going to be taking place in Graceland Event Center. Graceland Event Center, and we are kicking off by 11 a.m. You asked a question earlier concerning the activities of that day, of tomorrow. Number one, we're going to be having the teaching or the teaching on the topic in question. We're also going to be having some sub-teachings, and one of us here is going to be talking mainly on the effect of diet, the heart and the brain working together, because he's a he's a neurosurgeon, so he talks about the brain more than me. So, and that is Dr. Okolegwa. He's going to talk a little about, the connection of the brain and the heart as it comes to dieting.
Okay.
So he's also going to present a paper tomorrow, as it were. So
That's good.
Apart from these papers, we're going to or this top discussion going to be happening tomorrow. We're going to give some people opportunities to express themselves, as we said. They're going to express themselves, ask questions, and that. In addition to that, we're going to display our CPR equipment, and if possible, with availability of time, teach people how to at least primarily or preliminary do, pending when they visit, when we either come for training or they invite us to teach them. And so that will happen. Again, we don't assemble people and keep them. We also have to entertain them. Apart from the entertainment they're going to take in orally, that is eat, we're also going to have side attractions like cultural dances, as it were, and then some other presentations people are going to do.
Yeah.
And that's going to happen. Yes, the second and the third day are the free medical missions.
Okay.
The second, that's 22nd and 23rd. And the free medical missions will comprise medical consultations and treatment. We are going to be examining people's eyes and giving them eyeglasses, medicated glasses free of charge.
Okay.
And some basic laboratory investigations, taking your sugar level, HIV screening, and all that. Those things are going to happen on Friday. Again, on Saturday, we're giving people surgeries. So the surgeries are barely free. What I mean by that is that we allow people to pay a token, because in the past we have done surgeries that are supposed to be 200, 500,000, and they pay 30,000. That is free. Surgeries that you charge in the hospital, regular hospitals, 600, 700, and you come and say, okay, pay 30,000 so that you can, those who are going to operate, they are not, most of them, some of them are not members of the association. So you need to give them a token to go with. And so that is almost virtually free. So that's what happens. For people who will come and say, I think people say it's free. It is free when you look at it in quotes. But every other thing is free. Glasses, every other thing, nobody pays a dime. So, and that's happens. Yes, nobody pays a dime.
This is interesting, and I like the part where he said entertainment. So you're going to be taking in something. I love that part. Most people don't even want to hear. The side attraction for them is that thing they are coming to eat. So, all right. Thank you so much.
Somebody has asked, some people ask question, are we going to register? No, there's no registration fee whatsoever. Just come there. Your own is to come and listen and get something and go.
Yes.
However, the foundation is not, we don't get money from the blues. Do you understand what I'm saying?
I get you.
So some people, even though we are giving free, some people are sponsoring it, as it were. Not by compulsion, but by willingly supporting. You understand that? We don't compel anybody. In fact, some of us who are partners in the foundation, we are the sole financiers. Dr. Kulebe is here with his hospital. He is doing well in making sure that this foundation, the program moves, very well. And then Precious Stone Specialist Hospital, which I run, and then we have, that's why we call them partners. Yes, Dr. Richard Okoye of Save a Life, Dr. Dozier Anyanwu of Regions, and the guy that told in the US that gave us things to work with. So these are how we are majorly pushing this to, making sure that this thing works. And then we have a few people who give some donations, because it is something we're doing for the people. We are not, for us, he is stable in his practice, a consultant neurosurgeon in a federal teaching hospital, Were. He's stable. He also has a thriving private hospital. I work in federal teaching hospital as a general surgeon. So we are not looking for money from people. You understand that? We want to help the people.
Impact.
And so make impact. No, it's not for me. For me, it's not for me. If it's for me, I will not be. In fact, I tell my workers, if I stop working today, I will not be hungry.
Yes.
You understand?
Yes.
I will not be hungry.
Yes.
So not boasting, but who we are, and that for him too. Even though he's growing, I'm still. In fact, he's my student.
This is wonderful. Okay, I'm not going to come in between that conversation. Not be me una go you settle this one. Okay, so this has answered Kachisin's question and Ama's question. The program is free, and persons will have the opportunity to speak with doctors and also do the checkup for cardiovascular health. Even if it's expensive in other places, the foundation can actually do something about it to help in a way that will, cut down on the cost for you. And Ama asked about sedentary lifestyle and cardiovascular health. I know that all of those things will be answered at the seminar. So please make it down to Graceland Event Center, 21st, 22nd, 23rd, 24th, right? 23rd, yes. I wish we could extend it. All right, let's squeeze in more calls.
Hello, good morning.
Yeah, good morning, Dad.
Good morning.
Yeah, I called back.
Quickly, please, Kachisin,
okay,
quickly.
My name is Kachisin from Yeah, I want to ask you a question for one more thing you said. You talked about free medical eye check. And I want to ask, I have been to several free medical checks where they perform the eye checks, and what they found is only that equipment that looks like touch that they will flash into your eyes. Yes, because I wear glasses, right? So for frequently, I have been to the eye clinic, and I know the different equipment I go through to ascertain the particular issue you have.
Okay.
So I want to find out if the kind of equipment people are coming to check our eyes. And at the end of the day also, in most of these outreaches I have witnessed, they will just give a toy eyeglass. You know, you will not be wearing that one that is brown, kind of brown and small.
Okay.
So, are you coming with very good glasses for me? I wear blue cut.
It's okay.
Okay.
It's okay. Thank you very much. Whether toy glasses, blue cut glasses, glasses na glasses, oh, na free, oh. Eh? Okay, don't worry. Dr. Damian will help us answer that.
Yeah.
Let's see if there is one more person we can take, and then we'll try to summarize for today.
Hello, good morning.
Yeah, good morning, Dadon. How are you?
Fine.
Good morning, the Slim D.
Hello, welcome. What's your name and location, please?
Good morning, the doctors in the studio.
Thank you. Good
Thank you very
morning.
much. Good morning.
Yeah. I'm Prince. Shebezion.
Okay.
Prince, you're
Coming from
welcome.
Yeah, I've really taken my time listening to a lot of explanations, and then I came to understand that most of the things that they are saying here is almost that the things are free of charge.
Yes.
And then I really want to know, is it a government-sponsored program or a personal, maybe private parastatal? Because what I mean is, why I'm asking this is this: any program that is being sponsored by Nigerian government, I personally, I'm not a party to that.
Hey, voila.
Yes.
Prince,
Yes.
okay, I understand.
Yes.
No worries.
Secondly, you know, whereby they are doing most of the things here free, and I intend to ask, what do they intend having in return?
Okay.
Because it is very, very clear that when you get to the hospital, even with your money, before you can access the doctors in the hospital, I mean, you will suffer very, very well. They will tell you advance this, that, deposit and all that, blah, 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 and all that. Keeping you there at the end, the person might give up. So what really do they intend getting, going to from one place to the other, trying to maybe get people together to convince them, to give them free treatment
It's
and all
okay.
that. So I really want to know.
All right,
and God
thank
bless
you very
Appreciate it.
much. I wish we had all the time, but time is no longer our friend. I wouldn't know if Dr. Mack can, say something. He wants to find out if it is a government program, and what do you hope to get in return? Why are you doing this free of charge for people? You should be charging something, so you make something for yourself. That's what he's asking. Dr. Mack.
All right, thank you very much for asking. First of all, this program as of now is not government sponsored. Even though we wish that government could sponsor. Please, government officials out there, we use this opportunity to appeal to you. If you can, support, because this is a way to reach out, to give back to the people.
Yeah.
Now that goes to answer the second question. He said, what do we have to gain in return? Now, what we have to gain in return, most importantly, is the satisfaction that we are giving back to the people.
Okay.
You see, everything you gain might not be finance. It's satisfaction.
Okay.
In fact, most of us spend money for all we do for satisfaction. You go to a church, you go to a nightclub, you take flight, you enter a vehicle, is for satisfaction. This we are doing is for our satisfaction, that we are reaching out to people. That is the most important thing we have to gain.
Okay. All right. So before we go, I would like you as well to drop your parting word, key health advice to everyone listening at this time, Dr. Mack.
All right, thank you very much. I want to say that please take good care of your heart. Your heart is a major partner with your brain. The heart supports the brain almost all the time. And be available at this program so that you get a touch of that support that we're going to give to you to take care of your heart.
Thank
very
you.
much.
Thank you so much. Ambassador Uzoma, I don't know if you have any other thing to add. If there's anything you feel we did not touch on, now is the time quickly, and then you quickly give us your parting word.
Okay, I just want to quickly talk about the political part.
Okay.
I remember when we were going for the rally, people kept asking,
Is it
are you political? Are you from a party? We kept emphasizing with our megaphone that no, we are, this is a humanitarian service. It's for everybody and it's free.
Very good.
So I just use your eyes. I don't want to talk more. Just use your eyes and come and feed them tomorrow.
Exactly. Okay. Thank you so much. And back to you, the president, Dr. Okparacha Damian. Why should people prioritize this health seminar? And again, you help us with the venue, the time. If there are phone numbers, please give out the phone numbers so people can reach you for more inquiries.
All right, thank you so much. Just like my partners or the team members have said, it's important for you to come. And the venue is Graceland Event Center off Onisha Road. And that is at Graceland, near Graceland Estate. So,
is there a landmark?
Yeah,
Yes.
when you are coming from Owerri towards Onisha, that's Owerri Onisha Express Road, you stop at AA Rano filling station. And just trek, if you're not driving, just trek down to the venue by your left. If you're driving, the same thing. From Amakohe axis, from Amakohe axis, you stop. You take the flyover to the venue. There are buses waiting there, or if you are not driving, or if you are driving, just drive to the place. So time of takeoff is 11 a.m. and people expected to assemble, and so that the teachings will start. Yes.
Remind us of the days again,
the
please.
The days, the 21st to the 23rd.
Tomorrow.
However, the pre-medical outreaches are not going to take place at Graceland. So when people come for the seminar, we tell them how they can access the place where they can go for the free medicals. But we want people to come and hear and listen, not really for free medicals. Just like somebody has asked about whether they are going to get them breakable glasses and all that. Yes, we come with glasses that I've seen people who are still wearing their glasses for the past, since we started free medical outreach. They are still wearing them because I see that many people need it and all that. And then the equipment, we can't carry all our equipment to a venue that is just like you want to do operation, you carry all your theater there. So you carry what you can use to give the people the service, that the equipment that are necessary. So we can't carry everything. It's just, if you come to do heart operation, you go to the venue. So what we come with is a necessary equipment that is made to you. I mean, if you now have serious eye problem, we send you to where you can get the treatment. Of course, that is how it is.
Any phone number people can call?
0806 335 2651.
Again, please.
0806 335 2651.
Okay,
Yes,
thank you so much. All right, so you heard from Dr. Okparacha Damian. He is the president, Precious Healthy Life Foundation, and the managing director, Precious Stone Specialist Hospital. Thank you for coming, Dr. Damian. And Dr. Mark Okwelebe, MD, Mark of Glory Specialist Hospital. Thank you as well for making it down to the studio. And yes, Dr. Venn is not here, unfortunately, represented by Ambassador Uzoma. Thank you as well for coming to Echo FM.
Thank you for coming.
Okay, so Dawn, I don't know if you have anything to chip in before we run away.
Just come out and get the needed satisfaction that they said you need
Tomorrow
from this seminar.
we're not going to do Health Revolution. We'll run to that venue. So see you at Graceland Event Center off Onitsha Road, close to AA Rano filling station. For those who know the Onitsha axis very well, once you get to AA Rano, yes, it's not far from that particular filling station. And for more enquiries, call this number 0806 335 2651. 0806 335 2651. The heart supports the brain. You can eat and not still eat healthy. So please go and gather all the knowledge that you need.
Yeah.
No knowledge is a waste. My name is Mary Omeniwo. They call me the Slim Diva. You're most adorable.
And I am Judge Dawn Ikoma.
Up next is the news at noon. And yes, thanks to the media team as well. DJ Marv King will see you. Bye-bye from here.
Echo FM.
Echo FM 100.7, the fresh news people.
This week to help those in need.
If you know that it's God Almighty that created you and created we Nigerians like you need to do good things for us because the masses are suffering. How you can suspend me here? Are we are slaves?
And I'm going to win this election. That is the truth.
Stay informed with Echo FM 100.7. Join us for exclusive interviews with experts, breaking updates on local and global events, and in-depth coverage of issues impacting our community. Tune in every weekday at 6:30 a.m., 12 noon, 2 p.m., and 6 p.m. for our major news bulletin in English, Igbo,
Country people, this not story time. On top Echo
and Pidgin language. For more inquiries, you can reach us through our email, echofm@thekingmail.com. You can follow us on our social media handles at Echo FM. Echo FM 100.7 Owerri. We are the Fresh News People.
It's exactly 4 minutes past noon. Good afternoon to you, and our sincere apologies for starting off the bulletin behind shadow. This is the Global News at Noon right here on Echo FM 100.7 Owerri. My name is Mary Omeni Wode, bringing you the latest news and breaking stories around the world. Here are the headlines. Avoid reckless driving, overloading. FRSC warns motorists ahead of Eid. Abduction. Christian Association of Nigeria CAN declares fasting, prayer as Muslim rights concern. Murik demands action. Nigeria, Benin deepen cross-border security and trade cooperation. On the foreign scene, UK eases sanctions on Russian jet fuel, diesel imports. And Putin and Xi hail unyielding ties in talks after Trump's visit. And on sports news, AFCON 2027 qualifiers, Super Eagles to face Madagascar, Tanzania, Guinea-Bissau. Details shortly. The Federal Road Safety Corps FRSC has urged motorists to avoid speeding, overloading, and other dangerous driving habits as Muslims across the country prepare for the Eid al-Kabir celebration. The warning was given by the Zonal Commanding Officer of FRSC Zone RS10, Sokoto State, Shoba Akonde, while stating that the Corps had put measures in place to ensure safer travel during the festive period. He stressed that road users must also play their part in obeying traffic rules. He added that passengers also have a role to play by speaking up when drivers engage in unsafe practices that could put lives at risk. To support the operation, Akonde disclosed that more than 1,500 personnel, including officers and marshals, have been deployed across major highways and black spots in Sokoto Zone. According to him, the personnel will be backed by patrol vehicles, ambulances, and other logistics to ensure quick response to emergencies and smooth traffic flow. Akonde noted that the Corps remains committed to protecting lives through strict enforcement and public awareness, especially during peak travel periods like the Eid. He assured that emergency lines of 122 and 112 remain active round the clock for road users in need of assistance. In another development, the Christian Association of Nigeria (CAN) Oyo State Chapter has declared today a day of prayer and fasting for the rescue of the abducted principal, teachers and students from Ori-Ire local government area of Oyo State. Also, the Muslim rights concern Murik Oyo State Chapter has condemned the gruesome killing of innocent citizens during the recent abduction at Community High School Ahoro Esiele and demanded urgent action to secure their release. CAN's state chairman, Reverend Elisha Ogundiya, in a statement said the association was deeply saddened and disturbed by the attack when armed assailants stormed Yawota and Ahoro Esiele communities. It directed all churches in the state to observe prayer and fasting today and for the fast to break at 6 p.m. Furthermore, Muri confirmed that 3 persons have allegedly lost their lives so far in connection with the unfortunate incident. The group's secretary, Malam Ibrahim, in a statement said that 1 teacher and a commercial motorcyclist were reportedly killed during the process of the abduction, while another abducted teacher was later brutally beheaded in captivity by the terrorists. The Inspector General of Police, Tunji Disu, has deployed more detectives from the force headquarters Abuja to collaborate with the Joint Security Team as part of intensified efforts to secure the release of the abducted teachers and students of 3 schools in Ori-Ire local government area of Oyo State. An informed police source confirmed that the deployment was aimed at rescuing the victims unhurt. Governor Sheyi Makinde had earlier confirmed that 7 students were abducted from Community Secondary School, while 18 children and 7 teachers were kidnapped from First Baptist Primary and Nursery School, adding that 1 person was killed during the attack. This comes as palpable fear gripped residents of Ogbomosho over an alleged invasion of the town by bandits. The panic saw parents rush to schools to take their children home, while some schools hurriedly shut down. However, the Oyo State Police Command has described the alleged infiltration of bandits into Ogbomosho as a false alarm. Similarly, still on security matters, Borno State Governor Professor Babagana Zulum has assured residents of Musa community in Askira Uba local government area of the state, where terrorists abducted 48 school children, that efforts are being intensified to secure their safe release. The governor gave the assurance during a visit to Uba town to commiserate with parents of the abducted school children. Addressing the gathering, Zulum expressed sympathy to the emir, parents of the abducted children, and the entire people of Uba Emirate over the incident. He commended the military and other security agencies for their proactive response aimed at preventing further deterioration of the security situation in the area. He disclosed that the brigade commander, commanding officer, divisional police officer, and other heads of security agencies had been deployed to strengthen security and facilitate the safe return of the abducted children. The governor further called on residents of the Uba Emirate and Borno State in general to intensify prayers, especially during the first 10 days of the holy month of the Dhul Hijjah. It's exactly 11 past noon. If you just joined us, you're listening to the Global News at Noon right here on Echo FM 100.7. Here's a recap of the headlines. Avoid reckless driving and overloading. FRSC warns motorists ahead of Eid. Abduction, Christian Association of Nigeria (CAN) declares fasting, prayer, as Muslim rights concern Murik demands action. Nigeria, Benin deepen cross-border security and trade cooperation. On the foreign scene, UK eases sanctions on Russian jet fuel, diesel imports. Putin and Xi hail unyielding ties in talks after Trump's visit. And on sports news, AFCON 2027 qualifiers, Super Eagles to face Madagascar, Tanzania, and Guinea-Bissau. Details after this break. Stay tuned.
This is a public service announcement. In an effort to enhance road safety and minimize the risks of crash-related fatalities, Federal Road Safety Corps Imo Sector Command is urging citizens to promptly report any road crashes to the Corps Emergency Hotline. In the event of a road crash, citizens are advised to call the Corps Emergency Toll-Free Hotline at 122 to report the incident or any of the Imo Sector Hotline 0913 960 0904. Provide as much information as possible, including the location of the crash and the number of people involved. Stay on the line to receive guidance from the Corps Response Team. The Sector Commander urges all citizens to take an active role in promoting road safety by promptly reporting any road crashes. Together, we can work towards reducing the rate of road crash fatalities and creating safer roads for everyone. This message is brought to you by Echo FM 100.7 in partnership with the Federal Road Safety Corps Imo Sector Command as part of our corporate social responsibility. Thank you for listening.
Welcome back. If you just tune in, you are listening to the Global News at Noon right here on Echo FM 100.7 Owerri. Over now to the rest of the stories. And in business news this afternoon, the Nigeria Civil Aviation Authority NCAA has placed all domestic and international airlines operating in the country on high alert and ordered the immediate strengthening of port health surveillance across international airports following a fresh Ebola outbreak in parts of East and Central Africa. The directive followed the World Health Organization's declaration of Ebola outbreak in the DR Congo and Uganda as a public health emergency of international concern. According to the NCAA, the current outbreak involves the Bundibugyo Ebola virus known as BVD, a rare and severe strain for which there are currently no widely licensed vaccines or specific therapeutics. The Aviation Regulatory Authority stated that the measure became necessary due to growing concerns about the potential cross-border spread of the disease through regional air travel and trade routes. The authority stressed that early detection, prompt reporting, and strict compliance with public health protocols remain critical to preventing international transmission. Over now to the foreign scene, where the UK government has stated that it had eased sanctions on imports of Russian jet fuel and diesel refined in third countries amid spiraling fuel prices caused by the Middle East war. The trade license that came into effect immediately is of indefinite duration, according to the Department of Business and Trade website, and will be periodically reviewed. It will allow the UK import Russian crude oil refined in third countries such as India. The government also issued a temporary license, loosening sanctions on liquefied natural gas originating from certain Russian parts. Meanwhile, Britain imposed a stringent sanction regime against Russia following the 2022 invasion of Ukraine, targeting oil exports as well as over 3,000 individuals and companies. The decision follows a U.S. sanctions waiver for Russian oil cargoes already at sea, which was extended for the second time as its war against Iran squeezes global oil supplies and sends energy prices soaring. And And still on the foreign scene, President Xi Jinping has hailed China and Russia's unyielding ties in talks with Vladimir Putin as the pair met to underscore their alliance days after Donald Trump's visit to the Asian superpower economy. After the U.S. president was received with pomp last week, but left without major breakthroughs, including helping to reopen the Strait of Hormuz, Putin's visit will be scrutinized for tangible takeaways. Putin is, however, weakened by years of Russia's war on Ukraine as sanctions by Western powers put a squeeze on energy revenues and increased Moscow's dependence on China, which is the major buyer of Russian oil. The U.S. war on Iran has, however, hampered crude and gas flows, giving an opportunity to Putin to offer Russian energy sources as an alternative. Analysts believe that Putin could use the visit to push for progress on the major power of Siberia, natural gas pipeline from Russia to China through Mongolia, which is a land alternative to crude imported by sea from the Middle East. Meanwhile, opening talks in Beijing's opulent Great Wall Hall of the People, Putin and Xi were quick to laud their countries as special ties as they extended their treaty of friendly cooperation. And lastly, in the world of sports, Nigeria's quest to qualify for the 2027 Africa Cup of Nations received a major boost after the Super Eagles were drawn against familiar foes Madagascar, Tanzania, and Guinea-Bissau in the qualifying series for the continental tournament. The draw ceremony was held at the headquarters of the Egyptian Football Association in Cairo, Egypt, where the continent's national teams discovered their opponents for the qualification campaign. The Nigerian national football team, now under the guidance of head coach Eric Chelle, were placed amongst the seeded teams for the draw following their strong standing in African football rankings. Their seeded status ensured they avoided several of the continent's traditional heavyweights in the preliminary phase. The qualification series will be played across 3 FIFA international windows. Match days 1 and 2 are scheduled to hold between September 21 and October 6, 2026, while match days 3 and 4 will take place from November 9 to 17, 2026. The final round of fixtures comprising match days 5 and 6 will be played between March 22 and 30th, 2027, bringing the qualification race to a close. And that's all for the Global News at Noon this afternoon, brought to you from our news desk. For more information and inquiries, visit our social media platforms on Facebook at Echo FM and Echo FM_Owerri, X Echo FM_Owerri, Instagram at Echo FM 100.7, and YouTube at Echo FM 100.7. You can listen to us anywhere in the world by visiting www.echofm.net. That is www.echofm.net. My name is Mary Omeni Wode. Thank you for listening. Good afternoon to you.